Hello, my name is Dr. Gombele from drg.com. Hola amigo, ¿cómo estás? Te saludo desde Kingston, Jamaica. Bonjour mon ami, comment ça va? Je m'appelle Dr. Gombele. Mwana mboka, sangoboni, Dokotolo Gombele, Munganga Gombele. Don't go away, stay. Today we are going to continue with our diabetes treatment by the food that we eat. Last time we spoke about 4 elements that constitute the treatment of diabetes. The first, we spoke about education. This is what this channel is all about. The second, we spoke about exercise. We also say that exercise bypass the key in this channel, in this program. When we talk about diabetes, the key is nothing than insulin that opens the door in the vessel so that the sugar or the glucose can exit the vessel, get into our bodies where it's going to be used as a source of energy. So exercise helps. 3, diet. This is the foundation of the treatment of type 2 diabetes, and eventually medications, because depend on how patient comes to the hospital. If the sugar is very, very, very high, they have infections, vomiting, diarrhea, fever, and then we have to give some kind of insulin to bring it down. So we said education, exercise, diet, and medications. But this diet that we are talking about does not only help to reverse diabetes. It helps to reverse polycystic ovarian syndrome, IDID. It helps to decrease the level of obesity. It helps you with the chronic fatigue. I've heard people who go to bed tired, they get up in the morning tired. It resolves fertility problem in men. It resolves what? Fertility problems in men. Did you know that obesity is responsible for 20% of all the cancers? That means when you start losing weight, you are going to be avoiding 20% of the cancer. Mainly what? Breast cancer, colon cancer, endometrial cancer. So this diet, it's worth trying, it's worth of following. What about osteoarthritis? 35, 40, my knee hurt me, my waist, my ankles, my finger. And they will talk about all the causes except what? Obesity. So the diet is relevant, right? We need to follow a diet. So I thought we need to mention about another element of the diet that is equally important as the rice and bread, not eating bread and eating vegetables and this. But before we do so, I'm inviting you to like, to share, to subscribe, and to click the notification bell so that my very, 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 very next video that I'm going to upload, you can be notified. What about the fruits? Good question. Are fruits good for a diabetic, or fruits are bad? My intake into this is this. Fruit are great, but as long as you eat them in what? Moderation. We spoke last time about the glycemic index. This is how something that you consume convert rapidly into sugar and affect the existing sugar in your blood, or it converts rapidly and also what? Spikes the sugar. Fruit are not exceptions. They have high, low, moderate glycemic index and glycemic load. Therefore, we have to eat fruit in moderation. Maybe 1 slice of pineapple, 1 slice of mangoes. You cannot eat 10 mangoes and you eat rice, you drink whatever you drink, and you come to my office. What do you expect? Sugar will be high. And when I start questioning, what did you do? And they start smiling. Doc, you know what? I think I just ate too much mangoes. Oh, I ate 7, 8 fingers of ripe banana. Oh, I ate how many oranges? We have to eat those in moderation. I suggest you eat them early in the morning with empty stomachs, absorb rapidly, quickly, and you can move on. But you eat food and you eat again. Fruit, it just so mix up in the stomach. That will rise the sugar. We also say that flour, bread, rice, sweet potato, Irish potato, ketchup, salad dressing are our enemies because they contain enormous amount of sugar. Because we are talking about the treatment and we're talking about monitoring your diabetes, I want to guide you today, giving you some numbers. Okay? You must be able to stick your finger, put the strips in the machine, and read without problem. We are going to be going through 2 types of blood that you'll be checking at home. One is called fasting. Your last meal will be the night before, and early in the morning, like 10 o'clock, the previous night, early in the morning, before even brushing your teeth, before even drinking water, before even drinking a cup of tea, you stick your finger and you put the blood in the strips and you put the strips in the machine. It is normal if the reading is between 70 to 99. For those who have the machines that read big numbers. It's normal if it's between 70 to 90. Or you ate, and 2 hours after you stick again. It is normal if it's less than 140. Fasting again. You get up in the morning, you are not diabetic, and you stick, you get a reading between 100 and 125. Borderline. The sugar is high, but not high enough to call you diabetic. 2 hours after, you stick again, between 140 to 199, still borderline. You get up in the morning, you stick up yourself, the sugar is more than 120, you are diabetic. Or 2 hours after you have eaten, you stick up yourself and the sugar is over 200, you are diabetic. Now, for those who have small machines, you can just divide the numbers by 18 to get them in the small numbers. We mentioned fruit must be eaten, but careful on the portions. In fact, when I put people on my diet, I have them for 6 weeks without fruit. Because fruit have fructose. If your sugar is all over the place, if you continue eating fruit, it's going to be difficult to come down. So I take them completely off all the fruits. And then they just drink water and the diet. And the nut and the seeds. 1 handful of nut. Now, once the sugar normalizes, then they can eat 1 finger of red banana, 1 slice of mango in the morning, 1 slice of pineapple in the morning, 1 slice of melon in the morning. Of course, they must always be checking what? Their blood sugar. So diet, we cannot overemphasize over the diet. How diet affect diabetes. Affect it positively or negatively. I'm going to tell you things that even though I come to tell you, do this, do not do. Number 1. But before I say that, like, share, subscribe, and click the notification bell so that the next video that I'm going to upload, I can notify you. If I come to tell you, hi, guy, you just got diagnosed with diabetes, yes, Dr. Gombele. Hey, don't worry. Eat everything you want. As long as you exercise and you take your medication, you'll be okay. It will not work. Or your doctor tell you, guess what? You don't even need to exercise. Just take the medication as I will go to prescribe and everything will be fine. It does not work, will not work. That's one of the reasons people end up on 1, 2, 3, 4, 5 medications, and lo and behold, one day you go to your doctor and say, oh, you know what? Because the sugar is not controlling, I'm going to put you on insulin. Type 2 diabetes, you don't need insulin. In fact, you have too much insulin in your body. Remember, too much sugar means what? Too much insulin. And the more sugar in the blood, the brain sends a message to which organ? Pancreas, to secrete more sugar. And there are stages to develop diabetes. Stage 2, to develop diabetes type 2. Stage 1, insulin resistance. Your body resists insulin, and the pancreas starts secreting more insulin. Stage 2, hyperinsulinemia. Oh, big word. It just means too much insulin in your blood. Stage 3, insulin, when it comes to bring down the sugar, it gathers what? Fat. Because insulin is a growth hormone. More insulin you have in your body, more fat you are going to have. Stage number 4, borderline. The sugar starts going out of control. And stage number 5, you have full-blown diabetes. Sugar high, insulin high. So it is just not logical to start you with insulin. So if your doctor wants to put you on insulin, say, no, doctor, let us try something else. Let us try diet and oral medication, and then eventually you can put me on insulin. But type 2 diabetes, they may end up on insulin after 30, 40 years. The pancreas gets burned up because too much insulin secretion. Type 2 diabetes, a lifestyle disease. Low carbs diet. Stay away from flour. Increase your consumption of vegetables. We had said the other day that around your plate, half of the plate should be what? Vegetables. The other half you divide into protein and starch. Good starch I'm talking here. Yam, pumpkin, bulgur rice, we talk about quinoa, we talk about green banana. I'm not talking about white rice and white bread and Irish potato and no. That starch, no. And protein, whatever you want for protein. Then exercise, then education, then you will be able to win the battle against type 2 diabetes, which is the most prevalent of all the diabetes. What are there? Type 1, type 1.5, gestational diabetes, and drug-induced diabetes. Diabetes type 2 alone consists of 90 to 90% of all diabetics. And then, just a lifestyle disease that you can easily reverse. If you leave your number at the end of my presentation, if you follow the number that will be coming at the end of my presentation, you will be able to receive a meal plan. I will be able to answer most of your questions. Mbote, tikala malamu, hasta luego mon ami. Bye-bye. God bless you. Fight back. Win diabetes. Hasta luego.